I thank the executive members of the Tamil Sangam and Dr. Sridharan for effectively coordinating this session. This is my 6th visit to Atlanta. In 2014, after finishing the PETNA, I came here and give the lecture to the commission. So, already we finished 3 Siddha Wellness program in the help of Dr. Ravi Palaniyappan, Dr. Sharon, and other members present here. So I would like to thank all the coordinators of Tamil Sangam as well as the other members of Atlanta. And today we are going to talk about the non-pharmacological approaches of prevention of diseases. So we divided into 4 parts. The first part is the introduction to Siddha system of medicine, Dr. Arul Amuthan covered. The second part is the primordial preventive methods mentioned in the Siddha literature. So we are going to see some primordial prevention in this 10 to 15 minutes, and then Dr. Arul Amuthan will present the simple home remedies, and the last session is the practical session of yoga. There is the relaxation as well as the unique meditation method. So before going to the primordial prevention, so all well known about the non-communicable diseases. In 1900, there are communicable diseases are dangerous. Tuberculosis, cholera, or typhoid is the dangerous diseases. Nowadays, the non-communicable diseases. The non-communicable diseases is diabetes, hypertension, cancer. These are all the challenging diseases to the modern medical world. So how do we prevent or how do we manage this type of challenging diseases to the modern world is very challenging. Oh, yeah, thank you. Thank you so much. Okay, so you see from this slide, ischemic heart disease, stroke, and other diseases are non-communicable diseases. So how these are all preventable. In 90 to 95% of cancers are preventable. You all will know. This is smoking, not only smoking, alcohol. The incompatible food are dangerous to our system. There is a incompatible food means there is a white sugar, table salt, and adulterated milk, and artificial sweeteners, coloring agents. These are all dangerous to, not compatible with our system. It is going to damage all of our fundamental tissues. Dr. Arul Amuthan mentioned in his presentation, there is 7 fundamental tissues present in our body. So these fundamental tissues, incompatibility with these fundamental tissues is called many diseases. So in our session, we are going to cover the lifestyle modification, diet management, and Siddha yoga. So these are all the fundamental non-pharmacological approaches. It doesn't need any drugs, or it doesn't need any medical prescription to follow all these things. So one by one we are going to follow. In WHO also recommend the self-care to prevent, to promote the individual as well as the social health. So the first thing in the primordial prevention. So primordial prevention means the prevention of risk factors of the disease. If one are going to have a very big disease like the heart disease, the fundamental disease is called hypertension, diabetes. The prevention of hypertension is the primordial prevention method. It is very accepted by the modern medical system. So we are going to step by step, we are follow the Siddha literatures mentioned way back, 2000 years back. We are following these things. The first step is early morning waking up. The first question to all of you. So how many are waking early, 5 o'clock early morning? So very few. Difficult question. Okay. So the early morning waking up is preventing many diseases. So our life force has 3 dimensions. Dr. Arul mentioned in his preliminary speech, there is the Vadam, Hittam, Kabam. So, harmonization or regularization of the three principles, kinetic energy, thermal energy and the static energy. The regularization of these three energy is very much recorded by early morning waking up. So you know the neurotransmitters, endorphins, serotonin, melatonin. Endorphins is the endogenous marking. So it prevents not only physical ailment, also the psychological ailments. So early morning waking up also give better mental health as well as the concentration. So this is the first step for the prevention of many diseases. This is mentioned as a primordial preventive method, holistic primordial preventive methods. So the second thing is we are using many toothpaste. Many of our toothpaste contain toxic elements. So we analyzed at least 2,000 toothpaste used all over the world. So at least 16 toxic materials, averagely 16 toxic materials present in the toothpaste. Now, one of the most important toothpaste is toxic material is sodium lauryl sulfate. Another one is triclosan, nicotine, artificial sweeteners, coloring agents. So sublingual absorption of this SLS as well as the toxic material to the system, it can damage the normal functioning of our system. I think another question to you. So how many are using the herbal based powder? Not bad. It passed the paste. Many herbal paste also containing nicotine. So the many famous Ayurvedic Siddha herbal toothpaste containing high amount of nicotine. You should be very careful for using the herbal products. So the herbal Ayurvedic, these names are very popular. Organic, otherwise organic. We should completely focus on that particular products. So in India, 6 famous herbal toothpaste contain high amount of nicotine. It is very dangerous to our system in long term. So very much careful to using this treatment. So what is the alternate? We have the many, more than 50 alternate to the oral cleansing method. One simple method is, you all well known Tribala Churanam. So Tribala Churanam 100 gram, 5 gram of clove powder and 5 gram of salt. This combination is the best alternate to the toothpaste. This is very simple. By the same way, that is the toxic material enters to the sublingual absorptions. By the same way, phytonutrients present in this Tribala Churanam and clove enters through the system and enhance the our biological system. Yes. Yes, we are going to put all the PowerPoint in GCSMR website. So now the many of our presentation is available in the GCSMR website. You need more information, gcsmr20@gmail.com. You mail us, and we will all the informations we are going to put it in a GCSMR website. Okay. So the next step is first one is the early morning waking up. The second one is the avoidance of toxic materials in the toothpaste. So the next one is the early morning drink. After removal of the toxins from our system, we are focusing on the nirahara, whole rice fermented water. So the preparation you all well know. The preparation is mentioned here. So the trace elements, trace materials, the fundamental trace materials all are present in the nirahara. Okay. So I come here. It's better? Okay, no problem. So the essential elements, zinc, selenium, molybdenum and some other trace materials, zinc, are all present in the nirahara, cold rice fermented water. So the rare minerals are present in the nirahara. The one important thing is the rare vitamins B6 and B12 is enhanced by drinking this nirahara, cold rice fermented water. The first part of the intestine, gut microbiome preparing the B12 by enhancing the production of B12 and the B6 is very much observed by using this Niraharam. It is also useful for preventing many diseases as well as managing diseases like hypertension, irritable bowel syndrome, and inflammatory disease. So in Stanley Medical College, many research is going on. So the doctors, surgeons are using palaya sodu, that is a rice as well as the cold rice fermented water for managing irritable bowel syndrome and inflammatory bowel disease. Many other diseases, that is autoimmune diseases, are controlled by using this Niraharam. So the next step is using Niraharam. So bowel cleansing method, we replace our modern Western toilet with an Indian toilet by using this type of, it's available in Costco and other areas. So we just modify this Western toilet to the Indian toilet is very much useful for, so the complete evacuation, fecal stagnation is very much cause for many diseases. So the complete evacuation is very much required for preventing many diseases. So use these items. So conscious eating, this is more important. So conscious eating means 5 sense organ eating. We are eating with all 5 sense organs. By seeing the laddu or any green vegetables is very much useful. And we are hearing the sounds of the preparing food is also important. The last thing is the taste. So the 5 sense organ eating is otherwise called as conscious eating. So complete chewing gives you a satiety center of the, it is going to act on the satiety center of the brain. So it will prevent many non-communicable diseases, especially obesity. So the second thing is how much to eat. So 50% eat with solid food, 25% with water, soup, rasam, these items, and 25% keep empty. This is another rule. So how many times to eat? This is a very important question. So if you are going to have a yogi type of life, you need only 1 type of meal per day. If you are going to lead a normal type of normal activities, only you need 2 times. So the thrice a day becomes once a rogi, as a diseased person. So more than thrice a day is going to the palarogi. Palarogi means the more 2 or more diseases present in our body by somebody are eating 6 times per day. That is sort of palarogi. Not only palarogi, there is also drogi. So he is picking. That's called as a drogi. So this is the rule for conscious eating. Conscious eating prevents many diseases. Okay, this is another rule. So next item is the oil bath. How many are taking oil bath? At least once a day. Sorry, at least once a week. So in literature, it is mentioned that weekly twice. So at least once in a week. So the question, there's a slight modification of the question. So how many are taking oil bath with head to toe and oil putting instilled in all the 9 openings? This is the Ennai Kuliyal Vidhi mentioned in the Thereya literature. So you apply oil from head to toe and 1 drop of sesame oil each eyes, 2 drops of oil each nostrils, and 3 drops of oil each ears. And all the private spots should be soaked with some quantity of sesame oil. Allow it for at least 30 to 40 minutes and take a bath with the lukewarm water with the shikakai and herbal paste. So now the question, repeat the questions. How many are taking this type of oil bath once in a week? Sandamari. The only active person raising the hand is Chandamari. He is the pillar of Global Center for Siddha Medicine and Research. So, before putting this message to our website, please follow us. Okay, so apart from the joke, so complete bath at least once in a week with the herbal oil or sesame oil is essentially removal of the toxins. It enhances blood circulations. There is another circulation is called lymphatic circulations. Enhance the activity of the lymphatic circulation is preventing many diseases. So it also not only preventing disease, it is also used to normalize the blood pressure by activating the autonomic nervous system and improves the concentration and memory by removing the free radicals from our body. It is believed to prevent the aging process. So it is very important. So another thing is alternate to soap. Soap also contains antibacterial substances and toxins are present in all soaps. So SLS, again SLS is present in the soap. The transdermal absorption may cause many diseases. So alternate to the soap is herbal powder, Naligumavu. You know the Naligumavu, the herbal combination, 6 or 7 products we are using in the Naligumavu. So if you are not able to prepare that Naligumavu, just to prepare with the basin powder, gram powder 100 gram and the peel, the skin of lemon, dried skin of lemon, you should mix the food items. If you take 100 gram of kadalai mavu, simple kadalai mavu, basin powder, 10 gram of the lemon peel powder, mix both the powder and use it as the alternate to the soap. You can mix with for female, you can mix with a small quantity of turmeric powder. For oily skin, you can add rose water also for removing the dusty particle as well as the excessive oily substance in the skin. If you are in a dry skin, you mix with the buttermilk or small quantity of milk for the dry skin. So this is the alternate to the soap and shampoo. So periodical bowel cleansing method. Once in 4 months, we do the periodical bowel cleansing method. This is very much important for preventing many diseases. So the gut microbiome, you all well known about the intestine is the second brain. So gut microbiome, prebiotic, probiotic effectiveness is very much essential for the clinical practice. So once in 4 months, you do this detoxification method by mixing 3 simple combinations. The first one is the castor oil, ginger juice and honey. Each liquids you mix 4 teaspoons and mix with the lukewarm water. Take in the early morning. 4:30 to 6:30 is the ideal time for taking this detoxification medicine. And the whole day you need to follow some diet pattern. So you don't take any salt or chili powder or any irritable things you need to avoid. And up to 2 o'clock you should take only rice porridge, honey and buttermilk. After 2 o'clock you can take soup with porridge, buttermilk with porridge, and you can take banana or light, easily digestible food on that particular day. So the complete removal and toxin from our GI tract and reinstate the gut microbiome with the buttermilk. Proportion. This is proportion is mentioned here. If you have a 5-year-old kid in your family, each, that is the 5 to 8 years, each 1 teaspoon, 9 to 12 years, each 2 teaspoons, 13 to 17 years, each 3 teaspoons, 18 to 65 years, each 4 teaspoons.
Castor oil 4 teaspoons, ginger oil.
Yes, each 4 teaspoons. If you need, your kid need more palatable thing, you increase the honey quantity.
Not taken at one time.
Once in 4 months. One time, all together one time. So this is one important primordial preventive methods. So can we move to the next slide? Okay. So next is the so you can take castor oil alone, but complete evocation, complete reprogramming of the GAE track is using ginger juice is essential. Castor oil must certainly cook, but we need to mix all the three things.
You mix out honey or
yes, you can put a excessive honey. Sesame. Sesame oil is the ideal oil for us. So, just we finished all the things and we have a question and answer session. We will discuss on that. So, we have another one important session. There is a home remedy, and we are going to practice some simple, not a very big practice program. Very simple yoga training on finishing after finishing this Arul Amuthan session. So the next is sleeping. So sleeping is 7 to 9 hours is essential. If you are practicing pranayama or any yoga practice, you can reduce the sleeping time. So 7 to 9 hours is essential for preventing many diseases. The next important thing is stop using electronic instruments at least 90 minutes prior to the sleep. The same. 25 to 65 is the same. Total, I want the 25 left 65 25 consider. எல்லாரும் 25 க்கு அப்புறம் அப்படியே நின்றுவாங்க. சோ அதுக்கு அப்புறம் 25 26 அப்படினு சொல்றதுக்கு கூட 65 வரும்போது தான் அடுத்த வயசு 65. சோ அந்த மாதிரி நான் கமெண்ட் எல்லாரும் எல்லாமே so likewise that's why the slide is important. So this is very important. 90 minutes prior to sleep you stop. If you are using computers or electronic screens frequently for 8 to 9 hours, at least take a break in 3 hours. 1 drop of sesame oil to get instilled in our both eyes and allow it for 3 to 5 minutes and swipe it out and follow the progress. Okay, once in 3 hours. Once in 3 hours break is must. For preventing acute and long-term complications of the electronic rays, blue rays, in immediate effect and long-term effect. Immediately it has some dryness in the eyes, it has some watering or redness may occur. In long-term effect, you can face the irreversible changes like macular degenerations, like changes may occur by long-term. So by preventing this, the only thing, the sesame oil prevent the RNA damage by the rays is very much recorded by the recent researchers. So usage of sesame seed with palm jaggery internally as well as the external usage, oil bath and eye drops, it prevents many diseases. Okay? So avoid these items. So white sugar, table salt, to all well known. So try to reduce the usage of chili and tamarind. The alternate are white sugar, so honey, palm sugar and fruits. Sea salt, rock salt and black salt, pepper, ginger and garlic. The alternate to tamarind is the Garcinia kombucha. You all know about the coca. So otherwise called Malabar tamarind. So this is alternate to the tamarind. So refined oil, maida, modified milk, artificial sweeteners and coloring agents by preventing many diseases. You all well know that the toxic materials are present in these items. These are the incompatible to our system. So this is another incompatible food items. Don't mix with the items. The equal quantity of honey and ghee are toxic, and milk with the fish, meat, banana is also toxic. Yogurt with the fruit, cheese, egg, fish, hard drinks, meat, milk are toxic. So lemon with the milk, tomatoes, yogurt, drinking water during meals is also in this. According to our system, biryani with raita is incompatible. So next one is the important thing is mango lassi is incompatible.
No.
Palak paneer is incompatible. Okay. So at this juncture, I finish this session. These are all some minimal followable primordial prevention methods. So please follow these items, prevent many diseases. Next session is going to give by Dr. Arul Amuthan as home remedies. Thank you.